I'm Wynne Grossman, and I'm the Executive Director of the Dental Health Foundation. We're a statewide organization that really serves the public health function in oral health for the state. Our vision is oral health for all, and we work through partnerships to accomplish that, primarily at the community level. Well, unfortunately, the state doesn't fund much in oral health, and they certainly don't fund us. However, they do fund they have funded public-based oral health programs, primarily Denti-Cal, which is the Medicaid program, and the Children's Dental Disease Prevention Program. Those are two programs that we're really quite actively involved in, and which no longer, which the Children's Dental Disease Prevention Program doesn't exist anymore. It was suspended in July. And while the Denti-Cal does exist, it no longer provides benefits for adults. What's happening as a result of that is kind of twofold. One, more and more people are just simply delaying care because they can't afford it, particularly adults. And they wait till it becomes extremely serious problems. Dental disease isn't something that's going to go away. It's chronic, and it only gets worse. So if you got a problem, it's going to get worse with time unless you take care of it. And if people delay a small problem, it becomes a significant problem. And significant problems could result in infections, and in all sorts of complications, including heart disease. So people end up in the emergency room, and the costs are tremendous. Dental disease, particularly periodontal disease, are infections in the gum, and the infections spread. So consequently, when you have chronic diseases like heart disease and diabetes, the infection caused by dental disease has a negative impact on those other diseases. What happens when you lose adult dental benefits is when the adults aren't going for preventative dental care, even though those benefits are still available for children, they don't tend to take their children for that care either. And there's a number of studies that show that unless the adults are really going for those preventive visits, the likelihood that they'll take their children goes way down as well. So it impacts everybody by having those cuts. What happens is when you don't have much money, you don't pay for preventive services. You just simply ignore it. And you don't go into the dentist until you have a big need. When you have a big need, it's expensive. And if you have no insurance, it's a problem. I mean, you know, a couple of root canals or something like that, you're up to $3,000, $4,000 without blinking. People have to make a determination of what they're going to pay for. And there is some coverage for children. Again, I think if you're not getting, preventive care is not expensive. So getting early preventive care costs, you know, going in for a dental visit, it might cost $100 or a couple $100 maximum. But once you start getting severe problems, it's not hard to add up to thousands of dollars pretty quickly. And where a family is going to get that? And if you go into an emergency room because you have a severe dental problem, emergency rooms don't know how to take care of the problem. What they're going to do is pull the tooth. And more people are getting teeth pulled. What's going to happen to more frail adults? They're not going to have teeth to chew food. They're going to be on soft food. It's going to create poor nutrition. So it just is a cycle of problems that's going to be more costly in the end than the small amount of money we were spending on oral health. The Denti-Cal providers are significantly impacted by this. Around the state, The FQHCs, the federally qualified health centers, make up, and I can't remember, I think it's about 15 or 20% of the dental providers that accept Denti-Cal. The rest are private providers, the majority of which took adults as a primary portion of their population. Their ability to get those adults and get paid for those services is gone. So if you have 50 or 60% of your income wiped out, all of a sudden, you may not be able to stay in business. We know, for example, in Alameda County, Lifelong, which does have a dental clinic and serve primarily an adult population, laid off 40% of its dentists, since this happened. So consequently, I don't know where people are going to go. I don't know where they're going to go for services. The clinics can't operate on thin air. They need to have funding from somewhere. Well, Denti-Cal is paid by a procedure, so there's a rate for each procedure. Typically, California's rates for all procedures are in the bottom 1 to 5%, which means that if a dentist typically charges X, they get a much, much lower rate, and about only it's about the rate that about 1% of the dentists would accept as a reasonable rate. Other states pay Denti-Cal rates more in the range of about what 50% of the dentists would accept, and then you can get good participation. But our rates were always very low to begin with. I suppose when you wipe out a program, then those rates look good versus nothing. Unfortunately, this state has never put much emphasis on public oral health. We don't have a state infrastructure for oral health. Many years ago, there was a state dental director, but I've been the executive director of this organization for close to 8 years, and we have not had a dental director in all that time. And it certainly doesn't look like we're getting any better. As a matter of fact, there's been some infrastructure at the county level, but that seems to be dwindling away as well. So there's very little infrastructure that's been here. Well, I think there are two things. One is there needs to be some infrastructure for dental public health in this state. We've never had much, and now we have simply nothing. And that can't continue to exist. The problems that it causes by having nothing are going to be magnified over time. Secondly is prevention costs relatively little in comparison to the treatment needs that people have. And again, it's sort of penny wise and pound foolish to continue on in this. And every year we hear some sympathy from the legislature or the governor saying, yes, we understand, you finally convinced us that this is important, but we have other priorities. Okay, this is going on and on and on. We're never the priority, and things are only getting worse. And they're not going to get better by ignoring them, that is clear.